UCSF infectious disease specialist, Dr. Peter Chin Hong. Dr. Peter, thank you so much for joining us.
My pleasure, Gavin. Thanks for having me on.
Let's get right into it with ivermectin. In the headline, we even said it's an anti-parasite medication. COVID is a virus. So researchers from the get-go told us it wasn't the right drug for this, but why do people continue to keep taking it?
Well, I think early on in the pandemic, we didn't have any antivirals, so it made sense that we're trying to teach old drugs new tricks, and ivermectin was one of them. We are also looking at other drugs like hydroxychloroquine, some HIV drugs like Kaletra, but none of them really worked in bodies, in humans, even though in the test tube and on the plates, it looked like it could work. Part of it was that you can't really get the same levels or concentrations in the human body to make it safe, as well as inhibit the virus.
Okay. Let's talk now about the fourth COVID dose, because a lot of people, I'm going to put myself in the category, a certain age where you're really wondering if it is the right time, if it's the right dose for you. So first, let's explain some of the science behind getting that extra COVID booster and why we need to wait 4 months after our first booster.
Yeah, so we know, and we have known for some time now, that antibodies wane over 5 to 6 months, but antibodies aren't the only game in town when we think about protection of disease. So T cells and B cells that live inside of you, they have memory and they last for a long time. So that's why people can, with waning antibodies, get, breakthrough infection, but they don't go to the hospital. And that's really where we're looking at. But in the very old populations, we need to boost them from time to time. So that's kind of where we are. It really stands to benefit the most vulnerable in our population, particularly the elderly. And every decade above 50 gives you additional benefits. For example, my mom is in her 80s, and I'll definitely ask her to get a booster, a second booster. But for most people who are healthy in the 50s, they don't have to really rush out and get it per se, unless they're thinking about preventing breakthrough infection during a surge. And we don't have a surge yet. We may have one in the future, and we may have one with a new variant in the summer or in the fall. But nobody really knows.
You anticipated my next question, was exactly that. So somebody in their 50s may read all this information and say, well, I'm not going to get the booster right now, but if I see signs that another surge similar to Omicron is coming, well, then I'm going to jump on it because I'm going to want that protection. Is that a reasonable response to this information?
It is a completely reasonable response. Notice that this is a could recommendation rather than a should recommendation. I think that, if there's a middle of a surge, particularly with a new variant like a pi or a rho or a sigma, you'd see that could go to a should. But right now, I think they're being permissive in allowing people to get it because, again, in the middle of a surge, it's tough to vaccinate millions of people at the same time.
And while I have you right now, while you follow these things, do we see any other variants of concern on the horizon?
Right now, so far, so good. We have the evil twin of Omicron, BA2, dominating now the United States, but we haven't really seen a big surge yet. We are, however, seeing increasing cases in about more than 10 states, so we're watching that really carefully. In terms of new variants, apart from, the spawn of Delta and Omicron called Deltacron, we haven't really seen any new completely variants being formed yet. However, it's just a matter of time. But right now, BA2 is really the dominant sublineage in the world.
Dr. Peter, after 2 years of this, I'm going to take so far, so good as a win for us right now. Dr. Peter Chin Hong, thank you so much for spending some time with us tonight.